Hi, I'm Dr. Nirmala Gonsalves from the Division of Gastroenterology and Hepatology at Northwestern University, Feinberg School of Medicine in Chicago. Today, I'm pleased to demonstrate how to use the I-SEE application to easily assess disease severity in patients with EoE using a real-world case example. The American Gastroenterological Association's Index of Severity in Eosinophilic Esophagitis, or I-SEE app, was developed to give clinicians an easy way to evaluate the severity of EoE in routine clinical practice. I-SEE allocates point values to key disease features, including symptoms and complications, inflammatory features from endoscopy and histology, and fibrostenotic features from endoscopy and histology. From these points, the app calculates a score categorizing disease state as mild, moderate, or severe. In this example case, a 27-year-old with a history of EoE presents to the gastroenterologist with difficulty swallowing solids. They report that this happens at least once per day. As a result, they have noticed over the past few months that they have taken smaller bites, eaten more slowly, and drank extra water at meals. This patient has a history of mild asthma. An endoscopy reveals localized edema with furrows as well as 20 eosinophils per high-powered field. Let's see what this case looks like when entered into the I-SEE app. First, we select the age group of our 27-year-old patient. Disease features may be weighted differently depending on this metric. The next screen is symptoms, where we add the daily occurrence of compensatory behaviors while eating. This is not a patient-reported outcome, but rather the clinician's conclusion regarding symptom frequency and can reflect any symptom related to EoE. As you enter each patient detail, you'll see their I-SEE score change in the colored circle in the top right of the screen. You can tap the More Info button at the base of each step screen for a description of what that disease feature may entail. Next, we can enter any patient complications, such as impaction or hospitalization, selecting all that apply. Severe features like esophageal perforation or malnutrition, commonly seen in younger patients, garner 15 points and automatically categorize a patient's disease as severe. This patient does not have any of the listed features, so we select none. Note that there is also an option to select when this data may not be available. On the endoscopy screen, we can note this patient's localized features of edema with furrows, and that no fibrostenotic features were noted. This patient's histology showed us an eosinophil count of 20 eosinophils per high-powered field, but no additional histologic features were observed. The app has calculated this patient's I-SEE score as 4. Classifying his EoE as mild. Once you've calculated an I-SEE severity score, you can tap the Resources button at the bottom of the final screen for an explanation of how the score was calculated. Although the I-SEE score is not yet validated to support specific treatment decisions, you may use this score to help your patients understand their disease progress or as an indicator that new treatment options could be discussed. For a patient with mild disease, you might discuss patient preferences around strategies such as diet therapy, proton pump inhibitors, or topical corticosteroid. With more therapeutic options such as budesonide oral suspension, which may also be relevant to discuss for this patient with mild EoE, and dupilumab becoming approved for moderate or severe cases, the treatment landscape is growing. This makes monitoring disease activity and severity essential to helping our patients understand their disease and discussing their preferences when it might be time to make a change. I want to thank the AGA for sponsoring the development of the I-SEE tool. We hope that this education helps clinicians to more easily and proactively evaluate disease severity in patients with EoE.